Certainly access to health services is not the same for everybody across Australia.
Our system does allow people with resources to purchase those additional services.
We do have a shortage of health professionals, and we see that across
No
Australia.
one who's interested in healthcare in Australia can run away from what can only be described as a disgraceful situation in Indigenous health.
I don't think our mental health system is of a world standard. There are still a lot of people falling between the gaps.
It's the state-federal divide. There's too much facility for governments and departments to be able to shift blame between one and another.
The collective observation is that all is not well with the healthcare system.
As waiting lists increase and the healthcare needs of the community become more complex, state and federal governments continue to be divided on how to best manage Australia's faltering healthcare system. To find a way to tackle these problems, more than 50 organisations have come together to form the Australian Healthcare Reform Alliance. Their purpose is to drive much needed change in Australia's healthcare system.
It essentially was a number of organisations, interested organisations, brought together in a summit around about 6 years ago, and there was an agreement that in order to see some reforms come through, that there really did need to be a body of consumer and clinician organisations to drive it, and that's how the Alliance was born. It's a group that believes that we need to have greater equity in our system, and our system also needs to be more efficient, and the decisions about the system really need to be made by the people who provide the services and receive the services.
The problems with Australia's healthcare system are numerous and complex, and there is no easy fix.
There's a number of things wrong with our healthcare system. First of all, governments over the last 2 decades have let our workforce run right down. So we don't have enough nurses, doctors, allied health professionals. The average nurse is 47, doctors are ageing, so our workforce is in big trouble. Secondly, unlike most other countries in the world who have swung their healthcare systems around to put an emphasis on prevention, on the maintenance of wellness, on avoiding chronic disease, we continue with a model that is focused very much on hospitals and on the management of chronic conditions.
So we're still very focused on the acute end, what happens when people get really sick and whether they can get into hospital in time and so on. So it's very much, what happens at the bottom of the cliff when people have fallen over rather than time spent building better fences at the top.
And then we have major problems in our hospitals because we have too many hospitals for the amount of staff that we can put into those hospitals and run them safely.
Everybody can see that there is great inefficiency, particularly between the federal and state divide. Whenever an issue arises, the federal government says it's the state's responsibilities and the state government says it's the federal government's responsibility. And it leads to clinicians spending time having to chase resources for consumers, and it leads to expenditure on 2 different health bureaucracies that just isn't necessary at all.
Politicians of both persuasions have been promising for 20 years to fix this mess, but they haven't. 9 departments of health for 20 million people. It's a ludicrous situation. $4 billion in duplication wasted every year.
I think Australians are appalled at the state of Indigenous health. It's a matter of national shame that Indigenous people are dying 30 years earlier than other Australians, that Indigenous children are dying at 3 times the rate of non-Indigenous children.
The whole Indigenous health problem highlights the fact that health in its broadest sense is not so much about doctors and nurses. It's about social justice, it's about employment, it's about happiness, it's about housing. All those things have to be encapsulated as we try and improve Indigenous health because the communities are so terribly disadvantaged in every single regard.
It's not a matter of money for fixing Indigenous health, it's a matter of political will, and that is a strong platform for the Alliance. We're all united in calling for a greater investment to address Indigenous health and to address that Indigenous health gap within a generation.
Despite the size of the task facing them, the Australian Healthcare Reform Alliance, working as one united body, is confident they can make a difference.
The things that this alliance advocates for are major and fundamental reforms. Rather than approaching politicians and advocating for piecemeal policies that might bring about sort of short-term changes, this Reform Alliance is actually interested in quite fundamental and long-term changes to the health system.
I think this is the first time that a whole range of organisations have come out collectively and said, look, this isn't working, we need to find better ways of doing this. It's not an easy issue to solve, but we need to do something about it. Now at least it is being seen as, well, look, we need to do something. It's still difficult, there's no doubt about that, but at least it's on the agenda. There's a long way to go, and it will be a long-term process, but I think some of the early steps can happen now for us to start developing options.
We also want to get the governments to get together and form some sort of health reform council, something that can actually drive health reform. And reform on a large scale in health doesn't happen without a body to drive it, and that's one of the main things that the Alliance is calling for.
There are many major problems that we need to tackle in Australia. There's no shortage of goodwill and ideas about how to fix it. We need leadership, we need the community involved so that they understand what and have a chance to express what it is they want from a health system in this day and age. And that's what the Alliance is all about, trying to catalyse these changes, get the political leadership that we need to take us forward.
I think the most important thing is getting a system of citizen engagement in healthcare reform, actually getting people to, in a considered way, make decisions about what it is that they want from a health service, what their priorities are in healthcare delivery. I think for me that's the most important thing that the Alliance could achieve.